So we're talking about doctors and patients today. And again, for people who come to the talk cold or haven't been to the others in the series, the whole point of the series is to try and give people who are interested in family history a different way of approaching their family and looking at different sources that you can use to understand your family's experiences. And so I'm struck as I get older how much more preoccupied I get with my health and how much everyday conversation revolves around discussions of health and how we are feeling. And so it just seemed appropriate then, if we wanted to get inside the minds of our ancestors in the past, that we would look and try and look a little bit at what their experience of health and the medical profession was like. Because certainly prior to the 1800s, illness was a constant threat for everyone, and even minor illnesses, things that we would consider today to be very minor things indeed, like constipation or a cold, could be serious and could lead to death. In Dublin in the 1730s, dropsy, piles, quinsy, or tonsillitis all killed people and are recorded as causes of death in some of the in the corporation's death records. So you can understand then why many people in the 18th century and 19th century too were massively anxious about even more serious illnesses like the epidemic diseases, which spread across Europe at various points. And probably the two big ones were the plague and then smallpox, and then to a lesser extent fever, or as we would know it, typhus. And I suppose we could even think too about tuberculosis as these sort of terrible diseases. And so when we read letters of people that have been left behind, quite often very affluent individuals like bishops or clergymen or members of parliament, they're filled with their anxieties about their health. Mrs. Delaney, an 18th century Irish gentlewoman whose letters have been massive or have been frequently reproduced, talked frequently about her health and the health of her friends and family and what they could do to alleviate it. And so what did people do then to deal with their poor health? Well, of course, as in all of these things, it really depended, on where you lived. Okay, so we need to think about the impact of urban versus rural living. So if you lived in a city or a town, you were far more likely to have access to what limited medical treatment there might be. If you lived in the country or in any sort of an isolated place, you would have far less ability. I mean, and that's true today. And I don't think it's any different than it is now, or than it was then. Okay, so we're thinking about your location, your geographical location, as having an impact on your access to medical treatment of some kind. But it would also depend as well on your status and on your wealth, because medical treatment was very much provided on a voluntary basis. It was very much provided on a pay-for basis, and so if you were wealthy and could afford to pay for a doctor, then you were in luck. But if you were poor, then your ability to access the latest in medical treatments would be much more limited. So in terms of then the type of medical treatment that you might access, we would think about, say, a doctor as the most obvious one, but you would also think maybe about going to a medical institution of some kind, like a hospital or an infirmary or a dispensary. We'll talk about some of those a little bit later on. But you might also think about being treated at home using your own remedies or the remedies of someone in your neighborhood. So there are a range of different types of treatments. And so what we need to remember really about medical treatment in the 18th, 19th, early 20th century is its variability. and that there was no one common practice which everybody adopted. There was quite a wide variety of practice. But of course the doctor really was the key and probably the most standard approach. Now in the sort of pre-1800 period, there were largely, roughly speaking, 3 different types of medical individuals who would have been consulted. And at the very top of the scale, you would have the physician. There were very, very few of these. In Ireland, in the early modern period, there was very little opportunity for medical training. So many of the doctors who lived and worked in Ireland would have been trained either in one of the Scottish medical schools or more further afield in Europe. Between 1693 and 1793, the Royal College of Physicians let about 150 or so doctors into into fellowships with them. Okay, and again, we'll talk about the RCPI a little bit later on. So you can see that it's not a lot of doctors, a lot of physicians kicking around. But that's not to say that those physicians who were on the island, they were well trained, they knew about the latest in medical developments, but it was about getting access to them, which again would have been reserved for the wealthiest. Now underneath the physician then, there was the occupation of a surgeon. There were a few more of these, but not many. Surgeons trained on the job for the most part, and in the 1690s were included with a number of other occupations into a single guild. Unfortunately, these 2 occupations, barbers and periwig makers, did not really lend themselves towards the status to which surgeons aspired. Apothecaries were also thrown in there, and I'll talk about apothecaries in a second. So the surgeons really over the course of the sort of late 17th, early 18th centuries were really trying to establish themselves as a separate profession. And eventually in 1784, the Royal College of Surgeons in Ireland was established, and they separated themselves then from apothecaries. Now a surgeon was often considered by a physician to simply be dirty hands. So a surgeon was the one who did the manual work of dressing a wound, of lancing a boil, setting bones, which would have been based on the diagnosis carried out by a physician. But nevertheless, surgeons clearly developed a range of understanding about a variety of medical treatments, and not only did they simply carry out the instructions of physicians, they also did a range of medical practice on their own. And then the third sort of category of doctor then were the apothecaries. These were in essence the doctors of the poor. Their technical role was to make up and supply medicines on the instructions of physicians and surgeons. But once again, they too also did a much wider range of things. In 1747, they set up their own sort of trade guild and operated that way. So most doctors then in the 18th century had adopted what's known as a humoralist approach to the body and to medicine. And this was the idea that our health was derived from the humors in our body. And there were 4 of these. One was phlegm, one was yellow bile, one was blood, and the other one was black bile. And in order for bodies to be healthy, there needed to be a balance between these 4 humors. And if you were unwell, it was because one of your humors was out of balance, and your humors therefore needed to be restored to balance. And really, the way that this was carried out for the most part was by releasing these unhealthy humors out of your body. So if we think in the nastiest possible way and are inspired by the television series Horrible Histories, which loves to dwell on 18th century medicine. This is the time of the emetic. Any attempt, this was the treatment of bloodletting, the treatment of purging, and inducing vomiting in order to try and restore the humors. And so the techniques of cupping and blistering, so deliberately trying to bring up blisters on the skin, was the way that doctors felt that good health would be restored. But it was clear that many of these treatments were obviously not very effective, and people put up with them because they believed that because there was nothing else, because they did believe that they actually work. But over time, it became very popular to apply another number of treatments. One of which was taking water or drinking water, particularly or bathing in spa waters and mineral springs. And so really it's in the 18th century that Bath emerges as a destination for the wealthy, for people who are unwell, who are trying to get better. And of course, doctors soon observed that when you went to a nice provincial English town and you drank a lot of water and you ate some nice food, that you might actually then begin to feel better. And so this then led to the idea that some doctors began to espouse, which was healthy eating, rest and recuperation, and a temperate lifestyle could actually do a great deal towards improving your health. And so this kind of runs alongside and begins to, of course, gain ground. But the 18th century is also the time when there is a whole variety of heterodox medical practice taking place. So the 18th century sees the rapid growth of patent medicines that are peddled by quack doctors. Because again, the training for doctors, which we'll talk about a little bit later, was highly variable, and if not at all. And there was really nothing prior to 1858 to stop anybody from simply calling themselves a doctor, whether they had any training or not. So this whole kind of quack doctor, the ads in the back of the magazine sort of medicine that we would see today, with the grand claims for restorative properties and health claims and all the rest of it. This is really a very important part of medical treatment. But we mustn't also forget too the whole notion of what I would call folk medicine, the idea of or what were known as handy women, or bone setters, or herbalists, or wise women who would have had a knowledge of and understanding. And certainly you could almost even include midwives or women who helped other women with childbirth in this whole category of informal or heterodox, as historians call it, healers. And then finally, there is, I suppose even underneath that, is what everybody had themselves, which was their own common sense or traditional remedies which they had used in their family. So this provides hopefully a bit of a survey of the state of medicine prior to the 19th century, when much of it all begins to change. So what I'm hoping to do in the rest of the lecture is to talk a bit about the changes that take place in medical practice over the course of the 19th century, and then look at ways that if you have a doctor in your family, you could find them, or you can use patient records to find out a bit more about your family too, and we'll explore some case studies. But before we go any further, I wanted to just, I've talked extensively in this series how published recollections and memoirs and autobiographies by people from the north of Ireland are a huge, I think, an underutilized source for helping us to understand more about what our families experienced. And so there's lots of memoirs that have been published about growing up in a particular area or locality, and quite often there is a section or two about medicine and local treatments and that sort of thing. I've talked about Michael McClaverty and the insights that he provides into life in working class Catholic Belfast at the turn of the 20th century. But I also want to mention, well, just simply because she's handy and I've read her work, Flora Mary McDowell, who, did any of you read her at school? Yeah, she used to be on the school curriculum in Northern Ireland. And her books are lovely, and they talk about rural life outside Doak in County Antrim, again, at the turn of the 19th century. And so I just wanted to read just a little bit then from both of them talking about the way in which people were really as late as 1900 dealing with medical illnesses. Okay, so Flora's been describing the washing, which she says that most of the time her and her sisters wouldn't have gotten to see because you would only have seen the washing if you were unwell, and children were not encouraged to be ill. She said Mary had once disgraced herself, though not by being ill, for even Aunt Letitia realized that the lump, carbuncle or boil on Mary's head needed the attention of a physician. So Dr. Stevenson was sent for, and Mary, who was suffering agonies of pain, sat stiffly on a chair in the drawing room awaiting his arrival. When he came and asked her in his kind, breezy fashion how she felt, she stood up and said, "Very well, thank you," and fainted on the hearthrug. But the doctor was called for only in emergencies, and all the best home-produced treatments were used instead for everyday ailments. Okay, so you can see here how families would have had this repository of rural knowledge that they would have used to treat the great variety of everyday illnesses. So every spring, Aunt Letitia prepared a mixture of treacle and brimstone, and each morning every child had a large spoonful to, quote-unquote, clean the blood. Apparently something mysterious happened during the winter to dirty the scarlet syrup, and when the first birds started to look for nesting twigs, out came the sulfurous mixture. Many of the cottagers around still dug out dandelion roots or chopped the leaves to make a decoction for the same spring cleaning, so that everyone's blood was thoroughly cleansed by the time Easter arrived. Although many old women could still gather herbs to make teas and medicines and salves, one drug was invariably purchased, as it was greatly relied on for all sorts of purposes: Epsom salts. It acted as a blood cleanser, an aperient, a diuretic, a cure for rheumatism, boils, cancer, and arthritis. It acted also as a catalyst in whitewash to produce a smoother, longer-lasting finish to cottage walls, and mixed with water it produced finer roses in the garden. It was a cheap and easy way to cure tonsillitis or quinsy. The coal shovel was covered to a depth of ½ inch with coarse salt and set on the open fire to heat. A woolen stocking had a knot made in it at the ankle and into the bag, so the salt was carefully poured, and she goes on to describe about children. Then she talks about the role of licorice balls and deworming children and all the rest. And so I think that that's great. McClaverty talks about his character Colum, who's come from Rathlin Island with his family to live in West Belfast. "It's a cold you've got at the boat. It'll go away in a few days." Colum's mother put warm olive oil into his ear and told him to turn in and sleep. But sleep he couldn't, for his ear buzzed and jagged through the long night. At times he prayed and cried silently, trying not to waken his brothers. But of course the earache doesn't go away, and it just gets worse. All the next day the pain in Colum's ear was intense. His mother kept him in bed, and now and again he cried out as the pain tore through his ear like a hot wire. Alec went for the doctor, and Colum was ordered to the hospital. That night he heard from his bed a motor creak to a standstill outside the house, and he has this then sort of vague recollection of somebody collecting him, being put on a stretcher, being loaded into the back of the long car, and then taken to what I thought was the hospital when I was reading it, but then I realized it was the Workhouse hospital. Okay, because he's then taken into the ward and then is fitted up in bed, and it's a children's ward. In the morning, the boys from the ward come over and they ask him his name, where he lived, and what ailed him. A nurse came round, and while she was making the beds, the boys sat on their pillows on the floor. She came over to Colum with a big bottle under her arm, and he heard a boy say that it was white mixture. She gave him some in a tumbler, and he swallowed it in a gulp, made a wry face, and wiped his mouth with his shirt sleeve. A boy gave out mugs and enamel plates stamped with blue letters, B.U., Belfast Union. The mugs were half filled with tea, and 2 pieces of bread were laid on the plates. A nurse hung a white card on his bed, and a boy lent him a book and gave him half an apple. The first morning went slowly. And he's in the hospital for really about what feels like about 6 weeks, really. And the whole time it's an ear condition, and the nurse treats it sort of every day, and they play and on their beds and this sort of thing, and eventually then he's better and is released home. And McClaverty talks repeatedly in his novels about earaches and ear conditions. So it must have been something that he must have suffered from, or whatever. But I hope that that gives you an idea then about the way people themselves would have experienced, because much of the rest of the lecture will be rather devoid of a human involvement, I think. So what I want to do now is, like I said, is to go on and talk a bit about the developments in the 19th century, and then talk a bit about how we might find doctors and patients, and then do like a case study of an example that I've worked on. So we've talked a bit about this pre-19th century medicine, and we're going to move on now to talk a bit about the 19th century. Over the course of the 19th century, if we look at the different types of provision, again, there's no sort of consistent approach to the provision of medicine. There were medical institutions and hospitals and medical charities to look after people that were set up by private and voluntary charitable societies. So you've got all of this medical practice which has been set up by charities and which is run by public subscription, people giving money and donating. There's also then the state, as in the broader British state, which imposes the Poor Law on Ireland in 1838. And again, it has, although that's meant to deal with the poor often get sick, they can't afford voluntary or private care, so the government begins to try and implement medical care for the poor. And soon workhouses come along with hospitals. And then finally then is local government. County councils or towns, corporations, all, again, try and deal with the medical health of their inhabitants in some way, shape, or form. So there's this huge kind of variety of practice. Let's look first of all at some of the institutions that are established. Because really, prior to the 18th century in Ulster, there was no hospital care whatsoever. People would have been treated at home, either by their own home remedies or by a doctor who would have come by. There were other institutions in the landscape, but a proper hospital, as we would understand it, really was something that only begins to be established. Now, the earliest hospitals in Ireland were built in 1718, 1720 in Dublin, followed by Cork. And eventually in 1766 the government passed an act to encourage the establishment of hospitals, which led to the 1767 establishment of county infirmaries in Down, Antrim, Armagh, and eventually in Tyrone by the 1790s. These hospitals were meant to have a county surgeon who was to be suitably trained and qualified. But really, these were very, very basic institutions and were largely nursing homes, and were really not places where medical treatments were carried out in any large extent. Now, the voluntary hospitals for Belfast occurred in a different way, as we probably all know, in that the sort of first hospital as such was established in 1774 by the Belfast Charitable Society, the poorhouse on Clifton Street, which established an infirmary for the sick and also provided some dispensary care. Now, if we distinguish between an infirmary, right, which is a place for the treatment of the sick, A dispensary is really a place simply where, almost like a modern day doctor's office, where you would go to get a treatment and then go home. Dispensary care could also actually take place in your own home, like the home visit. This early infirmary of the charitable societies developed and expanded. In 1792 it became known as the General Dispensary, and in 1797 expanded again to include a fever hospital, where it moved then to Berry Street. This hospital eventually goes on to become the basis for the Frederick Street Belfast General Hospital, which eventually goes on to become the Royal Victoria Hospital. So these were all voluntary hospitals where the medical staff was largely unpaid. So I would like to talk a bit about the dispensaries, because dispensaries, as I've described them, emerged in the 18th century, and again, they were funded largely by philanthropic organizations, and they were encouraged by laws which were passed to establish organizations to provide free medical care for the poor. The problem, of course, was that their distribution was erratic. It depended on individuals getting together to form a committee, to apply to the government, to found one. And their success then was based on gaining regular subscriptions. If a dispensary was established, the government then had an obligation to charge rates on the local population to support it as well. Now, dispensaries in the 19th century had a resident doctor or a medical officer or an MO, but there was no requirement that he have a qualification, and in some places the position of doctor could actually be purchased by an enterprising family or individual. Dispensaries were improved in 1818 and 1836, but the Devon Commission, which was an inquiry to look into the quality of life for the poor, showed many of them to be very bad. They exaggerated the number of patients they dealt with, they were badly managed, and many of them were a front, largely speaking, for medical officers to gain an income. So dispensaries were then part and parcel of a wider reform of 19th century poor legislation that resulted in the passing in 1838 of the Poor Law Act. So the Poor Law Act, as I'm sure you're all familiar with, transformed the way in which poverty was dealt with by the state, in that Ireland was divided into a series of unions, and each union was meant to have a workhouse. And the workhouses were the way in which the poor were meant to be taken care of. And within the workhouse there was two types of relief. Workhouses were, there was indoor relief and outdoor relief. Now indoor relief meant that you needed to enter the workhouse, families would be separated into wings for men and women, and within the workhouse, inmates were expected to engage in work quite often. But again, many workhouses over the course of the 19th century would have been obliged by legislation to establish an infirmary or a fever hospital, or sometimes both, alongside them for this dealing with the sick poor. And so the Poor Law then becomes another way in which hospitals and other medical institutions are established. The Poor Law remained in operation in Ireland until 1948, when it was replaced with the NHS, in essence. And they became hugely important institutions in the dealing with health and welfare for all sorts of people. Okay, so let's talk a bit about doctors and nurses now. So, as I suggested already, prior to the 18th century, doctors didn't have any qualifications. They simply had a reputation. Or they may have trained with another doctor and gotten a reputation that way. They may have trained in the military. Both the Army and the Navy had their own their own doctors, and many doctors in Ireland would have been recruited and trained during the Napoleonic Wars, and then demobbed after that. Or else you could have gained some experience of being a doctor by attending on a hospital and basically hanging around and watching other people doing it. So in Ulster there was no medical school, so if you were from the north of Ireland and you wanted to become a doctor, you would have had to either go to Trinity College. Now Trinity only admitted Anglicans to its medical school until 1795. It really only had a medical school from 1711. So prior to 1800, there were really only 19 graduates of Trinity's medical school who came from Ulster. Almost all of the other doctors from the north of Ireland went to Scotland or to Europe. So of the doctors that we know about, 65 would have trained in Europe and 76 would have trained in Scotland. Now this was for the highest qualification of physician, but as we know there were other types of a medical practitioner that you could gain a license to be. And again, over the course of the 18th and 19th century, these institutions had also been established. So there was the Royal College of Surgeons, there was the Apothecaries Guild, and so on. And there were several others. Okay. And if you're interested in this sort of early medical life, then William Drennan, the Belfast Presbyterian and liberal and great writer and member of the United Irishmen for a while, studied in Edinburgh and wrote extensive letters to his sister Martha McTeer, where he talks about what it was like to be a student. And from his conversations, you can see that at times it was not easy; it was quite difficult. So after 1800, then we see the expansion of medical training and the growth of degree programs within universities, and the decline in doctors who didn't have any qualifications. Because by about 1850, most Ulster doctors would have had a qualification. There was a general shift towards Glasgow for their medical training, and a rise in the number of Ulster candidates who went down to Trinity to study as well. Now what's sort of interesting is that with the foundation of INST, the Royal Belfast Academical Institution, there was a movement within the school to try and set up a medical faculty. So between 1835 and 1849, INST actually had a medical, the collegiate aspect of INST had a medical faculty. It closed when the Queen's colleges were opened. It was really then when the establishment of Queen's College, now Queen's University, that there was a medical training of a high level within the north of Ireland. Now what happens soon after the establishment of the Queen's Colleges is the change in legislation. So in 1858, the Medical Act made a medical qualification a requirement for all doctors. And a medical council was established and a medical register established so that all doctors who wanted to legally practice in the United Kingdom had to be registered with the medical council. So more and more doctors then had to take university degrees in order to pass the requirements of the council. Okay? And in 1886, an amendment to this act said that all doctors had to be qualified in medicine, surgery, and midwifery. Okay? So most Ulster students then, after about the mid-19th century, began to go to Queen's College, Belfast, and took what was then a 4-year training course, which led to the qualification of MD. Now, in the first 25 years of all of the students who entered, only about 50% managed to qualify, and 30% left their studies incomplete, while 20% settled for a lesser medical qualification, like that of, say, surgeon or apothecary. Most students who would have attended Queen's would have been Protestants, and a very small proportion of Catholics would have studied there. Most Catholic students would have traveled down to Dublin, where they would have studied at the medical school attached to the Catholic University in Dublin, which is the forerunner of UCD. It had established its own medical school from 1855. And so, so increasingly then, after the mid-19th century, doctors have to be registered and have to be qualified. Okay? But I wanted to talk about two other aspects then of the medical profession, one of which is the role of women in the medical profession, and then looking at both doctors and nurses. Because the passage of the Medical Act formalized the exclusion of women from the occupation of doctor. Prior to registration and the creation of a profession, if you will, that has entrance regulations, women could potentially have been doctors had they wanted to have been. There was no rules or regulations that said they couldn't. But it was a relatively informal exclusion from the profession for women, but this was now formalized after 1858. And it coincides then with the rise of feminism and other campaigns for women to gain access to higher education, and so the campaign for women to become doctors really gathers speed in the 1870s and in the 1880s. And really, the acceptance of the medical profession of fully trained women, although they were really nasty about it and quite often said mean things in public about women doctors, but formally and institutionally, if you look at the institutional responses of the Irish medical profession, they're really quite liberal. So by 1885, the Royal College of Surgeons in Ireland agrees to allow women, and it was the first College of Surgeons in the UK to do so. In 1889, Queen's College admits women to the medical school, and in 1893, Queen's College Cork follows suit, and in 1896, the Catholic University of Ireland, UCD, in Dublin, does the same. By the 1890s, about 35 women have actually qualified as MDs in Ireland. And while some of these women were actually from other countries seeking qualifications that they couldn't gain in their own countries, most of these graduates were Irish, but only 15 of them were actually practicing in Ireland in 1900. Most had gone abroad and were serving as medical missionaries. By 1911, though, the number of women who were actually practicing on the island of Ireland had increased significantly, well, had increased a little bit. So it was possible then for women to gain a medical qualification, but the status of nurses then in the medical profession remained a very low one, and was one dominated by women. And again, there was no formal training for nurses in the sort of the pre-19th century period. Over the course of the 19th century, as more and more nurses were required and employed in the various institutions, there was sort of on-site training. But the dominance of nursing was, or the majority of nurses in the 19th century would have been nuns. and particularly in workhouse hospitals in the areas of Ireland which were dominated by Catholics. And much of this, the influence of nuns did much to prevent lay women from seeking to enter the nursing profession, and did much to ensure that the notion of nurses training was something that was considered not essential. It would be too expensive, many institutions argued, to have trained nurses. And right up until the 1920s, hospital authorities were viewing nurses as, with what one of their historians has called a completely feminine face, and as almost little more than charwomen. And so pay and status remained very low. It was only then in the early 20th century that, or in the mid-20th century, that nurses training was developed and implemented. So, what I wanted to talk about for the rest of the talk is how we might go about trying to find our ancestor if they were or happened to be a doctor or involved in the medical profession in some way. The most obvious place to start is, and the easiest place for us to start would be the street directory, because street directories list doctors under inhabitants. So this is the street directory for Larne for 1901, and you can see a drain, Dr. James, Main Street here. You can also, and so it's very easy then to track a doctor in this way. And what's kind of interesting is that as well, doctors would have been listed by their profession, okay, in the alphabetical section of professions or occupations of the directory. So here I've listed dentistry, and you can see there's a list of all of the dentists in Belfast in 1901. And if you got very lucky, you could find that maybe your ancestor had taken out a full-page advertising his 21 years practical experience, moderate charges, painless extractions, which I'm sure which is a great selling point. I also like Robert McAdams' advert on the next page there for high-class artificial teeth, rather as opposed to low-class, artificial teeth. So street directories are crucial and vital, good starting points. The training of doctors, because it was so institutionalized, there's lots of records associated with the training of doctors that you can search. It might not be very well known, but if you have the name of a person and you're related to them, you can ask Queen's if you can ask the Queen's admissions department for access to their records. So if you have somebody who studied at Queen's in the medical school, you might be able to view their admissions records. However, Queen's University also published a list of all of its students up until about the 40s or 50s every year. And some of those prospectuses are on the shelves at Queen's in open access, but all of them are in their special collections. And again, you can ask permission to go and use and access those records. Medical directories exist sort of floating around, and there's a variety of them, and certain sources about medical history will give you the names of what those are. But you shouldn't also forget the other potential sources, which are other people who've maybe written biographies about your ancestor. So the Dictionary of Irish Biography, again, might turn up some doctors. And the Ulster Medical Society, which was established in the 19th century to try and promote and to be a voice for the medical profession, has a number of biographies and allows you to access their journal in full. And again, so there's some interesting information there. If we turn towards hospitals and looking at hospital archives, again, Street directories are a really great source for hospitals. Not in terms of the actual personnel records or anything like that, but in providing a little potted history of what the hospital was like. And again, in the front pages of the street directory, there's great descriptions of all of the Belfast hospitals that existed in the late 19th, early 20th century. Don't forget to publish biographies and biographies of hospitals and hospital histories are again vital sources. And then, of course, there's the actual archives of the hospitals themselves. Many of the hospitals that have closed in the north of Ireland, their records are all here at PRONI using the code HOS. And we'll see about that in a second. But if hospitals are actually in existence still to this day, some of them have archival departments and records, which again, you may be able to access. Okay? I point you to the National Archives, which is based in Kew Gardens outside London. Now, Kew and the National Archives is the repository for records for the government, the state, the British state, if you will. And prior to partition then, it was responsible for collecting records for the whole of Ireland, and has really a wealth of resources that do relate to people who live in the north of Ireland, and particularly resources prior to partition in the 1920s. The National Archives also has some fantastic help guides and supports where you can explore records in more detail. I also find too that given the anniversaries that the National Archives' emphasis on military records is quite high. So if you had doctors or nurses who served in either of the first two world wars or in some kind of military capacity, then the National Archives has great resources in helping you try to find out whether or not there are any records that survive. So what I've done here is I've just clicked on N for nurses, and you can see here that you've got guides to help you search sources for military nursing, patients, doctors, and nurses, Royal Air Force nurses, and Royal Navy nurses. Again, I've had quite a lot of luck with sources for women who entered like the Wrens and things like that, and that their records are actually held in Kew and are digitized, many of them. So there's potential there for material that might be of use. And then, of course, there's always the online databases, right? Ancestry has quite a lot of material that you can subscribe to and pay to view. But don't forget the Ulster Historical Foundation, who I always like to plug as well. It's like 30 quid for a year to become a guild member, so it's not expensive. And again, you can see here, I've just listed two of their apothecary databases, and they have trade directories as well, which you might not be able to get easy access to otherwise. But the UHF's probably biggest contribution to medical genealogical knowledge is the recently published Directory of Ulster Doctors who qualified before 1901, which has been compiled by R.S.J. Clarke. And this is a huge 2-volume work which does exactly what it says on the tin, in that it lists all of the doctors that he's been able to find over 16 years of research who qualified in before 1901, who came from the 9 counties of Ulster. And just to give you an example, this is sort of a typical entry. So you'll see here's Randall Blair, a surgeon from Larne, and tells you a bit about him and provides the source background as well, so you can track down the original sources for yourself. This is a massive work, a massive amount of scholarship, and should be, I'm sure, widely used for many years to come. But I think it's more, I'm a little more interested in how we might try and find patients, like my family, for example. So how can we go about trying to find our family who may or may not have been patients at one time or another? Unfortunately, there's the Belfast City Hospital, but actually you can see that it's the original Workhouse building in the background there, because this is really the workhouses and the poor law have generated the most records, which are useful for us in this area. So most of the records of the poor law records are deposited here at PRONI, where they've been given the code BG, which stands for Board of Guardians. And if you go onto the PRONI catalog, you can see there under, and you can browse the 27 poor law unions in the north, and you can then dig down into each level to see what records actually then survive for each poor law union. Okay, and I've been interested in Larne Board of Guardians, which is BG 17, and you can see here, if you look at the top, I'm only looking at the first several of 51 different record series for Larne Poor Law Union, and it's a lot. There are a great number of records, different categories, and it can be quite confusing because there's a lot of material on what might be useful and what isn't. If you dig down again, you can see there into the next level, another series of books and registers. And then finally, when you get down to the individual record, okay? Now, part of the reason that I've included this slide is because of the issue of privacy and data protection, which governs these records. Many of these records are, I suppose, medical records or personnel records that involve confidential details about people and individuals. And the government has a 100-year rule which says that much of this material must be closed to the general public for 100 years after the date of the last entry in the volume. So, if you are interested in the Workhouse Register for Larne for December 1910 to January 1913, if you look up to levels, you'll see that the access is open to that record. That means that you can request that record here and view it. However, the next volume in the list from January 1913 to June 1915 currently says that it's closed, which means that access will be refused, right? If you go up to the window, right? So that happened to me a couple of times. But yes, I know that you can request, if you have a person or know your family member and where they are, you can make a request to PRONI and they will be more than happy to facilitate your access to that record, okay? But you have to do it on a case-by-case basis, right? You can't actually say, I just want to see whether or not there are any want to see like the whole thing for Larne, right? Okay, so you have to ask to see the Ogilbys, right, in Larne. And, okay? So, but my point is that doing this research much beyond 100 years ago is a little bit tricky, okay? And just to be aware of that. Because the same thing is true for hospital records. So again, I looked under the HOS prefix for East Antrim, and sure enough, PRONI has records relating to the 3 hospitals that have been in existence around the area of Larne. And again, some of these records are open, but many of the more sensitive ones are closed, and I would need to then make requests to view. Okay, so in order to kind of help guide you through the morass of workhouse records, I thought I would list the ones that are the most important, or the ones that are most significant for genealogical information. And again, if we consider the difference between indoor and outdoor relief, you can see that E refers to registers that are related to people who were relieved in their own homes. Okay, so people who were not who were given relief or support, but were not obliged to enter the workhouse. Okay? And the admission and discharge books show quite a bit of detail. G refers to indoor admissions. These are the big books, which everybody talks about. But also you might be interested in the medical relief registers too. And there's also vaccination books and other things which record a degree of genealogical information. The other thing to remember too is that it depends on your union what has survived and how much you're actually going to find. So what I did was to give you a sense of the starting dates and the coverage of just a selection of unions here at PRONI. Some of them are excellent, like Ballymoney. You've got indoor registers from 1843 right up to 1949. But for Derry, as far as I can see, you've got an indoor register for 1910 and 1944 to 48. And Derry Union is very few records have actually survived for that. But Clogher's fantastic. You're just coming down with material from Clogher. And others are very good. So it really depends. So I recommend, again, search for your general area and see what's there and just try and use what you've managed to find. So I just wanted to show a couple of examples then of the sources. Here's a typical outdoor relief register. Again, you can see here, there's an index at the front of each volume, so you can search for the name and then by number. So this is Nancy Ogilby, female, age 53, laborer, widow, and where she was from. It might not tell you anything more that you already knew, but you might see her in a different light. Here she is getting relief of some kind. This is, again, an indoor relief register, where you can see on the left-hand side people who are admitted, and on the right-hand side people who are discharged with some of their, with age at least, and recorded. Larne Workhouse has a register of births, right, for a particular period of time. And here's a medical relief register from Ballycarry, which has survived, which again lists all of the diseases which the medical officer attached to the workhouse would have alleviated. And I was so pleased to see that it wasn't all dreadful fever and typhus. It was things like dysentery, or, well, something as small as constipation, toothache, fever, hysteria. So, really quite, minor issues being dealt with as well. Here's a register of vaccinations from Glenarm, which provide the name of the child and the parents and where they lived. And we mustn't forget the lunatic asylums, which I haven't looked at all. And don't forget too the census. The census allows you to search for people who are in institutions. If you go to the Falls Road, you can find the census return for the Belfast Lunatic Asylum in 1901, and it lists all the inmates. Lunatic asylums, unfortunately, only list people by their initials, so it's probably impossible to use it to actually find anybody. So finding doctors in Larne, you can see what I did was simply to go through the street directory and to list everybody and to get a sense of the way medicine was dealt with in Larne in the late 19th century. But then what I did was that I accessed the indoor register for Larne Union, and then I searched for Ogilbys for the period 1896 to 1899. And this is what I found. I found 4 entries, 3 for probably 3 distinct people, 2 Ellens and a Nancy. And you can see what is interesting as well is that the young Ellen Ogilby, age 17, enters for about 5 days. Ellen Ogilby, who had fever, was in for a much longer time, probably until she was well again. And then she enters in again, I think, in August, still in bad health and destitute, but doesn't stay for more than 4 days. This confirms really what Alwyn Purdue and others who've looked at the poor law in Ireland say is very common, which is that people entered the workhouse for largely short periods of time to kind of get over a bad patch until they were up on their feet again, and that people didn't enter the workhouse and then live there and become institutionalized forever. That was really very uncommon. And what we can also see too is the outdoor relief register as well. Again, showing, and I think the amount of information that you get is really quite good. The outdoor register gives your marital status, gives the number of children that you've had, and when you were relieved, gives the townland and their age. So being able to plot that up against BMD evidence to get a sense of the occupational status and their poverty or relative wealth, I think these are really interesting records and useful for that. The last thing was to say is always the notion of serendipity, because you never know what you're going to find if you start poking around in your local area. So Larne had, for whatever reason, a district nursing society, and, for whatever reason the records have survived, right? It's fairly obvious why they had a district nursing society, and the whole point was to supplement medical care from the voluntary and workhouse hospitals with people who would travel around and go to the sick in their own homes. And there's really not very much that's there. You can see that's all the records that are left. But once again, you never know where names will pop up. There's a little pamphlet here which provides a list of people who subscribed to the society for the year 1897-98. You can also see the people who are on the committee and who were involved. And then for their War Hospital Supply Depot initiative, where they set up a depot for supplies to be given to soldiers. There's a whole ton of people who attend all of these meetings. And what's fantastic is that after a discussion, it was decided to close the depot on Tuesdays, and the suggestion that a Christmas gift should be sent to each local man serving with the armed forces, right? So this is really small scale stuff. Since the opening of the depot until the 31st of October, the following has been distributed. And it's really things like 110 mufflers, 30 pairs of mittens, 230 rolled bandages, 50 triangular bandages, and some sort of, and drugs possibly as well. So you can get a sense really from here about the community involvement in medicine during wartime, but also names that might not have come to you otherwise. So I'm conscious I've gone over a little bit. And say good luck with your research and finding your family. Thank you.